Welcome to our quarterly 211 training. We have a lot of content on food and food insecurity today, so we'll go ahead and get started. We will be holding questions to the end, or you can pop them into chat, and we will get started here in a moment.
You say something, Julie? What'd you say? No, sorry.
I'd like to introduce the people who are on our call today that will be presenting. I am Sandra Desteno. I am the director of 211. We also have Jill Bunge, the VP of Impact and Outreach at United Way of Greater Toledo, Emily Ruckel, the VP of Operation and Technology at Griffin Place, Emily Matthews, our 211 Program Manager, and Nautica Coucher, our 211 Program Manager, and also Kevin Crane, our United Way of Greater Toledo AmeriCorps member, who has taken the lead on our food insecurity project.
Wonderful. Thank you so much, Sandra. I'm Jill Bunge. I'm the Vice President of Impact and Outreach at United Way of Greater Toledo and also co-oversee the United Way 211 program. I want to first just give a quick shout out to our 2022 training sponsors, Medical Mutual, and our supporting sponsor of Aetna. Really appreciate them making sure that we're able to provide these trainings to the community. So we want to start today with a general overview of our 211 structure. This is our internal structure, how we operate locally. Hopefully most of you have some semblance of familiarity with 211, and perhaps you've interacted with us in some way. So standard in our introductions, we obviously have a local director here, 211 managers, a team of 17 local community resource advisors. These are the folks who are taking our calls, answering those, connecting people to resources. We have senior CRAs. We have 2 dedicated individuals who are our coordinated entry specialists. These are specific individuals who are trained to help facilitate our individuals who are experiencing homelessness and getting them into our coordinated shelters across Lucas County. We have our resource team. We'll talk about our resource database in a little bit here, but they're the folks who are making sure to call and check and verify all the resources that we have in our incredible database of health and human service providers in our community. And then we have our strategy and communication support on that United Way and Griffin Place side. So let's get into it. What is 211? 211 is a free, confidential service that helps people across North America find local resources that they need 24/7, 365. Over 20 million contacts to 211 were answered in the year 2020, and over 27 million connections to health and human services were made. You can see here that 96% of the United States has some semblance of a 211. We actually have 100% coverage in the state of Ohio, which was expanded during COVID to cover some of those counties that previously didn't have a 211 resource. So this is, while this is a very localized service, the 211 network is very expansive nationally. So when we think about the network that we're participating in, we still have our call to and our charge to operate the system locally and control over how that functions. So again, free, confidential, anonymous resource and referral. We specifically cover Lucas Wood and Ottawa County residents, providing referrals for as we say, anything under the sun related to health and human services. So job training opportunities, your basic needs like food, clothing, and shelter are always around our top calls. Health services, some of those specialized services like substance abuse, mental health services, holiday and food assistance. Not only do we have some of these long-term providers who are listing in our database, but we also have, one-off opportunities if people are doing something special or beyond what their typical programming is. We really try to capture a really comprehensive set of resources so that we can direct people to the things that they need when they're calling and presenting with some deficiencies in what they're able, what they need for their themselves or their household. Additionally, we also do mobilization during disasters and crisis response, which is evidenced certainly through COVID as our most recent example. I'm going to send it over to our senior CRA, Emily Matthews, who is going to talk about stats and community data.
Morning. Thanks, Jill. So now we'll take a few minutes to review some of the high-level 211 stats, top requested services, and explore our 211 counts page. So as you can see from these two images, over the last few years, over the last 4 years, 211 has seen a steady increase in our call volume, with 2021 reaching unprecedented numbers as a result of thousands of contacts seeking information regarding COVID vaccines. We did anticipate that 2022 volume would be less than the prior year because 2021 was a true anomaly. On the right, we have a look at the last 38 months of contacts offered and handled. The difference between offered and handled are those contacted 211 versus those that actually spoke to a CRA. As you can see, we saw a small spike in our volume back in March 2020 during the early days of the pandemic, and then a relatively steady amount of contacts between April and December of 2020. The three large spikes on the graph in January, February, and March 2021 were from contacts seeking COVID-19 vaccination, information, and appointments. As the vaccine became more widely available, the volume did begin to decline beginning in April of 2021. Our higher volume in the first 6 months of 2022 is partially due to the PRC COVID Emergency Assistance Program, which ended in June 2022. Here's an overview of our 2021 statistics. Last year, we had over 104,000 contacts to 211, a 53% increase in contacts compared to the year before. On average, each day our CRAs are receiving more than 275 contacts. We received over 2,800 contacts from veterans or active duty households, 22,000 from contacts over the age of 60, and served 15,000 contacts with minor children in the household. Lastly, in the area of stats, these are our top 4 requested services through 211. In most years, housing, shelter, utilities, and food make up the top requested services, but as of 2021, needs related to COVID-19, such as vaccines, testing sites, and general information related to the virus were also at the top of our requested services. So in addition to being able to call 211 and talk to someone, you can also search for the resources yourself in our online database. We have over 800 agencies listed who administer over 2,300 unique programs. Most of our agencies are local, but we also have information for state and national programs as well. We collect as much information as possible to be able to provide a referral for an individual, such as contact information of the agency, eligibility requirements to receive the service, hours of operation, and any documentation a person might need in order to receive the services. This ensures that when they arrive to receive the service, they have everything they need. We have database specialists who are tasked with keeping all this information as up to date as possible. Once annually, we send out a reminder to each agency to update their program information, but we're also updating it throughout the year. Agencies can log onto the website and update their information themselves at any time. CRAs are also reporting back new information or corrections that we get from callers or community feedback. Any incorrect listing is reported back to our database specialists for correction in the database. So our website looks a little bit different now. We just got a new website a few weeks ago. So to access our online database, you'll go to 211nwo.org and click on the Search Our Database button. There are 3 different ways that you can search the database. First, by keyword. Here you can type in food or support groups. And then you can also search by agency name or program name. For example, you can type in Red Cross or YWCA. And then lastly, the search has a built-in guided search by category. This is definitely the most common and recommended way to use the search, unless you know exactly the agency that you're looking for. So you can choose from a variety of categories such as housing, utilities, or volunteer and donations. But in this example, we'll be searching for a food pantry. So you'll first enter the zip code for the person looking for resources. And this will auto-populate the city. You can also put in the age or gender, but these are not required fields. And then you'll scroll down and select the category. Here we're searching for food pantries in the 43604 zip code. So we'll first click clothing, food, and personal items. This will bring up a variety of subcategories such as community meals, food pantries, and even pet food. We'll select food pantries. And then the results will be a list of pantries in proximity to the zip code entered. You can see a variety of options that have populated with the agency's name, address, and phone number. And you can also see the basic information about the food pantry service. To get more information, more specific information about the service, you can click the See Details link. This will provide further information such as service description, eligibility, hours, required documents, costs, and how to access the program. You'll also see other services available at that agency. And lastly, you can print, email, and text those resources. Since launching our site in the new online database, September of 2019, we've had over 47,000 website visits from over 19,000 unique users. Perfect. So if you previously called 211, you know that we ask each caller a few standard questions, including their zip code of the person that's in need, their age, among other things. And we also keep record of all the referrals provided during each contact. One of the most powerful facets of the 211 is the data that we're able to capture from contacts and community partners. So 211 animates this data through an online, publicly accessible dashboard, which shows the total number of contacts made, top requests, and categories of need for which people are contacting 211, geographic information of individuals, including zip code, county, congressional district, and their demographic information, such as age and gender. At a glance, this information can be a resource to get a pulse on community needs and to geographically identify areas of high need interest. It can be used for grant reporting or to advocate for to local officials. In addition to needs being reported out, unmet needs are also tracked in the 211 counts. So if a community resource advisor categorizes a request need as unmet, it might mean that the resource is not listed in our database, the individual doesn't qualify for the services, or that the service doesn't exist currently in our community. This allows us to get a better understanding what barriers people experience to getting service and sheds light on emerging needs in our community that service providers can help address. And now we'll transition back to Jill to discuss what makes 211 unique in the world of navigating health and human services.
Thanks, Emily. Appreciate it. So this is a question that we like to pose. Why not Google? Emily did a wonderful job covering the basics and some of the more nuanced features of 211. So we hope that the answer to this question is apparent. But 211 is really providing comprehensive information and referral service that's specific to our community. And this is something we really cite, when individuals are posing this question: why can't I just find this information in another space? I'm sure many of you, if you've worked with clients, if you've navigated the health and human services space yourself, you know how challenging it can be to find what you need, particularly if you are in a point of crisis in your life, if you don't have the bandwidth to do that. We really try to be intentional about centralizing all of this into one single space to make it as easy as possible for our community and our neighbors to be able to find what they need. And that's what really sets 211 apart. Additionally, the accessibility. So 211 is available to everyone in our community. In order to serve individuals, particularly with limited English proficiency or who have language access barriers, we have services with both our community resource database that Emily demonstrated via Google Translate, and then we also have a translation service over the phone. So if an individual calls in and speaks a language other than English, they'll just need to communicate their preferred language by saying Spanish or Arabic or French, whatever. Our CRA will then phone in a representative from Language Line, our translation service partner, and make it a three-way call. We also have the opportunity that if we provide a referral to someone and the agency doesn't have a representative that speaks that language, we can retain that translator on the line and then have a four-way phone call with the CRA, the individual seeking health and human services, the representative from the agency, and the translator to make sure that everyone's understanding and we can effectively have folks communicate together. We also do have marketing materials that are available in English, Spanish, Mandarin, and Arabic. So at any time, if you all want to request copies of that, we're happy to send digital versions to any community partners. And finally, this is perhaps the best illustration, in my opinion, of how 211 is really different. It's this human element of 211 navigation that's just really so critical. And I think this was showcased best through the pandemic. As evidenced by the statistics that Emily was pointing to, we played a significant role in the vaccination effort and helping people get registered, especially our older adults who were the first to have access to those vaccines. Navigating the online registration was really challenging. And quite simply, people just wanted to talk to someone, after a very scary and isolating time that we all experienced. That human specific navigation was just so critical to make sure that people were able to talk to someone and get to the end result of what they were calling for and what they really needed at that time. And many of our really incredible community resource advisors, they already have experience in social work or health and human services, but then they also receive training to ask some of these secondary questions, which helps them really better understand what it is that people need and how we can get them the resources that are best suited to their life and their circumstance. Maybe we provide them with those additional resources beyond what they were initially calling for. Also, sometimes services are simply not available in our community if a person is asking a specific question. So in this example, we have a caller who may indicate that they need help paying a car insurance payment. We might not have any agencies in our database that help with that specific need. However, our CRAs are asking that second question, right? They're having conversations. So we find out that the caller recently lost employment. So we can provide them with job finding resources. And then, another facet that we have in our tool belt is to say, how can we offset other costs to balance out your household budget and needs? Can we connect you with a food pantry? That's one of the easiest ways that we think about with offsetting costs. Utility assistance payment, some of those other things. So we're really trying to be creative and again, tailor this specifically to the caller. And speaking of food pantries, this concludes our 211 portion of the presentation. These trainings, we bring in partners and really try to highlight specific service providers or issues in our community that, we're dedicated to at United Way, but more importantly, that many of the providers in our community are tirelessly working toward and very passionate about. So we're really excited. I'm very excited to introduce Kevin Crane, our AmeriCorps service member, who's going to talk through some really extensive research that he's conducted as part of his service project around food insecurity, with a specific focus on our rural counties in Lucas and Wood today. So I will turn it over to Kevin.
Thank you for that very nice introduction, Jill. I appreciate it. So yes, I'll take over from here. I'd like to personally thank everyone for tuning in, and especially those that I've had I'm fortunate enough to talk to already. So my name is Kevin Crane. I am the Assistant Food Navigator here at United Way of Greater Toledo. One of the key categories that 211 does try to identify are households struggling with food insecurity. That has been alluded to throughout this presentation, but today's focus more specifically will be on rural food insecurity in our local Ottawa and Wood County communities. So according to the Ohio Association of Food Banks, they explain rural food insecurity, where millions of working families, veterans, people with disabilities, seniors, and children cannot afford and access enough food for an active, healthy life. So research has shown that rural communities have less access to food compared to urban communities. There's so many things that contribute to this. I'm sure as all of you know, but some of those do include lack of public transportation, just the geographical restrictions on everything so spread out, but also, limited healthcare infrastructure. And also there's a lot of research that points to how rural areas have higher chronic disease. So these are issues that differ greatly according to race and ethnicity and location. And this is actually indicated in the Map the Meal Gap from Feeding AmeriCorps. And Jill is going to actually send a link for you all if you'd like to learn more about Map the Meal Gap. So this is a report done by Feeding AmeriCorps that indicates that food insecurity is influenced by multiple factors, including poverty and unemployment. So the recent report does focus on rural food insecurity, similar to this conversation here. And it did determine that 1 in 3 people in rural communities are facing hunger, but do not usually qualify for SNAP benefits. So some of the shortcomings identified from this include that there needs to be more trust built in rural communities amongst community partners to better support those in need. It also acknowledges that there's a lack of disaggregated data available, meaning some populations are overlooked. The report also suggests that there needs to be more things done to address this, like how federal and state surveys must invest in adequately sampling and collecting food insecurity data. This is a great resource to check out, so please do. Thanks for putting that in there, Jill. And so, speaking of populations struggling with food, we have to acknowledge all the price increases people are dealing with. I mean, the numbers are quite staggering. From rent to grocery bills, people in Tri-County area are fighting all these price increases. And while inflation, of course, is making it worse, according to the Economic Research Service, ERS, in conjunction with the U.S. Department of Agriculture, USDA, there is a food price outlook that is seeing just massive increases. In fact, the rise of home food prices, according to this, has increased over 8%. So in some places, they're seeing an upwards of 13%. This is compared to a historical average of 2.4%. So foods that are seeing the biggest price increases are eggs, as you may have seen at the grocery store, dairy, oils, fruits and vegetables, but the biggest does have to be meat. So maybe you have experienced this yourself or seen this with the organizations you work with. So some of the changes in the consumer price index you can find here. I won't go too into this, but there is a CPI forecast that Jill will put in here that does indicate that meat is up over 7.5% and eggs are seeing an increase of over 20.5% in 2022. So check that out if you'd like to read some of those numbers. And then moving on, here's a graph from Feeding America that does help illustrate that costs are not just impacting household wallets, but they're also impacting food banks as well. They're paying more than 40% for food purchases to keep up with the demands. And we'll later get into how that's impacting food pantries. And of course, we can't talk about food insecurity, especially in the rural communities, without talking about our older adults and our senior populations. These are, groups that have been affected arguably most drastically by COVID-19. So according to the Ohio Association of Food Banks monthly service statistics, more seniors are seeking food than ever. Reasons for this include the ongoing efforts of the pandemic, but also there are other reasons for that, like healthcare costs, physical restraints, and perhaps lack of family support to drive them around or get food to their homes. So this does, so Jill will also include a link here. So thank you for throwing those in there real quick. It's a lot of numbers and I'm sorry to throw that at you so quick, but I do think it's very, very important to have a platform that we're continuing to speak. So once again, thanks for being here. We're gonna move in and talk a little bit about the COVID cliff. So for those who are not aware, SNAP is SNAP is a federal nutrition program that stands for Supplemental Nutrition Assistance Program. This is formerly known as the food stamp program. It does provide a card that is loaded with monthly allotments to pay for groceries. Unfortunately, SNAP enrollees will be seeing and experiencing a major drop-off in benefits. A drop-off in benefits, also referred to here as the COVID cliff, means that enrollees will experience that drop off in monthly food wages from their EBT card. And there is some ends to child nutrition expansions through WIC. And third, there is and possibly most impactfully, the Medicaid eligibility review for the first time in over 2 years. So combining these three upcoming drop-offs, it is pertinent that 211 has all agencies in our database. So when households call and are in need of food, our operators will be able to prepare accurate and up-to-date information on that. So check out that. The Ohio Advocates for the Advocates for Ohio's Future has some really great resources. So moving forward, the emergency food assistance can come in many fashions, but here we're going to talk about it as food banks and food pantries. Pantries source from food banks. So to better visualize the distribution of food from the time it was grown to the time it goes to somebody's house, just take a look here. Food is grown from farms. Contracts are made with government agencies like USDA that guarantee certain amounts of food get sent to food banks. And then of course, food banks store that food in warehouses where they distribute the food to food pantries, which is where most of my, my study is focused on. Food pantries are the ones that then distribute to the people. So just want to be clear there for those who may not already know this. So moving on with our local food banks, we do have 2 of them here in Northwest Ohio. We have Seagate Food Bank and Northwest Ohio Food Bank. Both do serve millions of pounds of food to the community per year, but they do operate a little bit differently. Seagate does take pride in being Ohio's only independent food bank, meaning that there is no large overhead that requires certain types of reporting. And then Northwest Ohio Food Bank is connected to Feeding America, which is a national organization that operates, that oversees their operations, essentially. Both food banks do serve food pantries, schools, summer programs, senior centers all across Northwest Ohio. So I think it's important to thank them for all that they do. But due to the COVID-19 pandemic, we have some of these, we have food pantries that have had to source from these food banks, but also historically they have too. So moving on, there are 2 types of food pantries that I've kind of identified, but also have been identified in the past. There are the choice food pantries and to-go food pantries. A choice food pantry is considered best practice, meaning they're, it's the gold standard of food pantries to some. On the other hand, there are to-go pantries that are quite different, but have arguably just as much impact. This is the style that many pantries adopted to during the pandemic because of the CDC restrictions. Some have gone back to their original models, but some have stayed the same because, well, it works best for them. So there are 9 out of 24 food pantries in the research I did in our Ottawa and Wood County that do provide to-go bags. And then the rest are still in that client choice. So moving into my research and project, as Jill and everyone has mentioned, I'm the AmeriCorps volunteer here at United Way Greater Toledo. And my research is focused on food pantries, we'll say, very specifically. But I learned quickly that you can't just learn about food pantries without learning the whole entire food network. So I took a very specific angle when I began this type of research. I actually, the angle I took was I wanted an honest one. I sought to make as much face-to-face contact with pantries in Ottawa and Wood County, but I also did make phone calls, and then of course emails and phone calls were sent out for that first contact. So special thanks to Seagate Food Bank, OSU Extension, Jobs and Family Services, and of course United Way, our branch offices, for helping supply information and contacts to help me get in contact with these individuals. So as you can see here, I did engage with a total of 24 food pantries. There are 29 identified, so I did not speak to everybody, although I did get to see and visit 17. So we'll take a look here at the Wood County food pantries. These are the ones, and you may see your name on here, so thanks for being here. We have a wide variety in Wood County. You can see that most are in Bowling Green. There is a chunk there. But the more rural, there are less options for food pantries. So this does offer some restrictions. And then moving on to our Ottawa County food pantries, Shout out to you all. 9 of them are participating in this research I'm showing you right after this. So yeah, there are a list of 11 here that have been identified. So since we are focused on rural food insecurity, it's nice to make the comparison to the urban setting where you can see so many resources here in the community. These are food pantries. And then you look at our Wood and Ottawa County food pantries, and well, as mentioned before, they're very, quite spread out. So just by looking at these images, you can kind of visualize some of the geographical restrictions that come along with food distribution, and not to mention the price that comes along with that. So the following will shed some light on what food pantries have been experiencing this summer. This includes finding out trends around food pantry operations, distribution of food, as well as other successes and challenges. But before I get into it, I would like to just say that it is important to acknowledge that our food pantries have undergone numerous changes, numerous challenges these last few years. So the pandemic brought about many temporary adjustments to help feed large numbers of people. These pantries have been flexible, they have been resourceful, and of course they have been resilient. So shout out to all of them. But moving forward into our research participants, in total there were 24 food pantries that participated. Overall, there were 15 from Wood County and 9 from Ottawa County. This right here is actually our the types of food pantries. You can see here that most of them are faith-based organizations, but we do have a variety of nonprofits that participated in this, and 2 universities being Bowling Green State University and Owens Community College. And then our the operation frequency will just describes how often food pantries are open, whether they operate weekly, monthly, bi-weekly, daily, or bi-monthly. Something that was identified was that most pantries are open weekly or monthly, so not too many that are open daily. A cool piece of information I was able to gather is how many households are being served, or a rough estimate of how many households are being served based off of our conversations at food pantries. I was able to gather that nearly half of the pantries serve between 26 and 50 households per month in Ottawa and Wood County. Rural pantries have consistently told me from my visits that they are not seeing much of a rise in the number of people served, but they are certainly concerned about the spikes in the near future when the pandemic health emergency ends on October 13th, and families will see SNAP major drop-off in their benefits. The next, food sourcing. Some pantries choose, as alluded to earlier, they do choose to source from either one food bank, neither food banks, or both food banks. So 20.8% chose to work with neither food banks. And then there are some that utilize just that one. And there are a variety of reasons for that. It might mean that they only need that much food and they don't need it from both food banks. And then of course we have our programs service area. So this describes how food pantries offer their geographical restrictions. So food pantries do tend to have a specific area that they service, meaning that food pantries will either accept people from their county, in this case Ottawa and Wood, or accept people from their district only. But then there are ones that have no restrictions and people can come from any county. So it is important to note that these pantries never say no to someone needing food for the first time, but they do offer some of those suggestions. And then the items offered is kind of cool to see that our food pantries don't serve, most of our food pantries serve more than just food. So it just goes to show that all that they do and responding to the needs of the community, we'll say. And then pantry challenges. So there are a lot of challenges that our food pantries are facing, as you all probably imagine. We'll get into some of those. 3 major reasons being transportation, food supply and shortage, and staffing and volunteers. The first one here, transportation. This includes transportation from the pantry to the individual homes and getting food there. We don't have really any food programs that are doing that. besides a couple that I'll note later. And then, of course, we have transportation from the food bank to the food pantry that has its own challenges. That is expense related, but also just food banks have limited capacity, which have resulted in logistical challenges. You can see a quote here from one of our Ottawa County food pantry coordinators that we are geographically challenged. We are just not convenient for anyone. And I can say this wasn't the only one that had mentioned something like that. So next challenge identified that our food pantries are facing is maintaining a consistent group of volunteers, but also for some, just having a streamline of volunteers that can come in and help support with some of the manual labor. And then, of course, we have our food supply and shortages challenge. The variety and facilities tend to be a challenge for food pantries. The variety meaning that they're just trying to find how to pay for the meat and dairy and other products they aren't getting sourced from the food banks and their donations, because donations have been down since the peak of the pandemic. So these are three major challenges that have been identified. And then a quote here: we have not gotten food from the food banks in over 2 months. That is something that, you know, one food pantry had mentioned, but this also alludes to the challenge of having facilities and having a permanent location and having storage where they can freeze foods and keep them for a long time so that they can distribute it in a timely manner. And then as I was just kind of talking about the staffing and volunteers, more along with that is just the hours of operation and staying open for a longer period of time. You know, there's a lot of restrictions and challenges there with, if you don't have enough volunteers, how can you stay open? How can you stock your shelves, and so on and so forth. And then, of course, I would like to keep moving forward. I don't want to under highlight some of these challenges, but we do want to get into some of the cool things, the exciting things like best practices. And so I was fortunate to learn about all the wonderful things that pantries do for their communities. I'll mention 2 food pantries, one in each county that have some best practices. Before I do that, it's important to note that some of the collaborative efforts that are happening today. So the coordination among providers is one of them. One is an example of this, I will say, is the Wood County Food Insecurity Council that was established with United Way support over 20 years ago. Though this committee only meets quarterly, they are a functioning body out of Wood County, and they do have food agencies and representatives that communicate, you know, in this committee, and oftentimes related to food insecurity or food pantry updates or educational opportunities, and of course an agenda that helps get more of the agencies in Wood County on board. And then another strength to both Ottawa and Wood County is how faith-based organizations share their partnerships. For example, many churches are in coordination with one another. This helps funnel in more donations, generate more awareness of the food pantries and providers in the area, which as a result gives food pantries and the faith-based network an understanding of where the most convenient food support for someone is. This is where some churches do redirect people to more appropriate food pantries that if they are more within their boundaries. But I'm going to go ahead and move forward here and talk about the brown bag food projects in Wood County. I had the privilege of meeting Amy and Peggy over there. That this is the first pantry that I visited as well. So wow, do they have a lot of awesome things going on. This NGO in Wood County is open 3 times a week and has a group of dedicated volunteers, consistent volunteers, and of course a streamline of volunteers that help with that labor. Those in charge create a welcome and accessible environment to anyone that needs food assistance. So I will say brown bag is also perceived well by the community because of the direct impact they're having on so many people's lives. One may be because they are one of the only food pantries that does food deliveries. So they have 3 different options for food deliveries, one being just a firsthand emergency, they'll go drive the food out. They also will even hire a third party in the past if they can't have a volunteer go out there. And this is even across border lines too, which is pretty cool. And then the most unique one is they did apply for a grant through DoorDash. So people are now able to go online and apply for delivery by DoorDash if they're eligible. As mentioned earlier, this transportation challenge is a huge one to identify, and this is a way of filling that gap. So thank you, Brown Bag, and all the wonderful work you do in Wood County and across Northwest Ohio. And then our second to highlight here is the Oak Harbor Alliance Chapel. I got the privilege of meeting Cynthia, who runs the chapel and runs the food pantry. They don't have any restrictions, so people come from all over, and they're filling a huge gap there. This means they also are servicing a lot of people. So they have a large number of individuals coming in, and they do have a community meal that is offered once a month. Although they're not in our 211 database, this is an organization where we're in communication with and hopes to get them added, and along with anyone who might be listening, and hopes to get you added as well. So there is a lot going on in the food space. These two pantries are examples of that, but one food pantry cannot single-handedly eliminate all food insecurity. It does, I believe, take a level of connectivity as a community and devoted organizations. So that is where I'll transition into talking about some opportunities here. It is clear that there are further ways the community can convene partners to better support those who are food insecure. This is really just foundational level conversation, but some potential opportunities include continuing to expand 211, convening partners dedicated to the same mission. Developing an informative monthly newsletter has come up to talk about, all the needs in the food space in a more centralized fashion. And, just bringing more actors into the conversation that might not already be on a larger scale. We know that all of you and all of our community partners are very devoted to the work that they do, but perhaps convening them in a more central place could be useful, like in Puzzlement or the Islamic Food Bank, which are two really great organizations here in Northwest Ohio that have begun some conversations with us and have been continuing. We want to also get you involved in this conversation. It's very important to us. So following this meeting, a survey will be sent out. So to anyone listening and interested, please complete the survey. This questionnaire is super short, just about what topics that you would like to see in the future. If you are a group and you want to find ways to learn more about how you can support food pantries in our database, just reach out to us. We're very interested in that. And so as for me, moving forward, I will be focusing on Lucas County food pantries. Yay. So it's not stopping. It is full ongoing. I will be exploring similar topics here and information around my findings in the future. So in addition to this, we have the University of Toledo is partnering with United Way this semester for an honors course on food insecurity. The class has been assigned a group project, and they will be providing recommendations and best practices based on research at the end of the semester. And finally, we have our community impact team here is dedicated to maintaining, just up-to-date information with policy work. So we're doing our best, like the Advocates for Ohio's Future link. They're an organization like that. We just keep trying to stay up to date on all of the changes that have been happening, especially with the upcoming COVID cliff and all of the waivers and other, just really anything coming from the government from the state, local, or national level. So once again, thank you for your time. I'm going to wrap things up here, and just thank you for your interest and your passion for being involved in this conversation. And obviously thank you for Ottawa and Wood County food agencies that are doing all the work on the front line. There's lots of future collaboration to be had, I believe, and we believe here at United Way and 211. So please feel free to reach out, provide feedback, ask questions for the end of the discussion. And I'll transition back to Jill. Thank you.
Thanks, Kevin. I'm going to bring this home, but wow, deep breath, a lot of information in a short amount of time. Thank you so much for laying all of that out. We will open it up to questions and conversations. Just a couple more things here to kind of tie a bow on everything. You know, we know how many of you are so deeply committed to resolving food insecurity across our community. And, you know, our angle from 211 is that we really want to serve our community as a connector to all of the folks who are doing emergency food assistance and who are, as Kevin said, just on the front lines, dedicated day in and day out to making sure that people have food on their table and that they're taken care of. So the strength of 211, though, as Angel and I were discussing in the chat, is really, you know, making sure that we have strong buy-in from the community. We need folks to register with 211. So please encourage providers to make sure that their services are listed, to be sure to notify us if changes occur or if you have special events that might be taking place, especially around the holidays coming up. We know that that's a big time that people are looking for those needs. And we have controls in place to make sure that we're giving a certain number of referrals to folks. We really want to work with you as an agency to make sure that this resource is listed correctly so that we're sending people to you who are in need, who are, within your parameters of who and what you are serving. So, I also encourage all of you to call 211. We always love direct feedback from individuals who are utilizing the service. We really want the service to be, our program is in service to the community. So we want it to be the best that it can be. And there are actual human beings behind 211, who are doing the work. And we really want to connect with you individually. And moving forward in the food space, to echo Kevin, we want to work with providers, we want to work with community members to really understand those gaps. Both of our county staffers are on the call today as well, bringing their expertise and their community connections. So please really, we want to talk to you, and we want to know how we can work together and what we can do on the United Way side to support you all in the work that you're doing around food insecurity in our rural communities, but across our 3-county footprint. And our final slide here, there's 3 ways to reach 211. You can dial 211, of course, from any phone. We also have a 1-800 number, 1-800-650-HELP. We have text functionality where you can text 898-211 with your zip code and chat directly with the CRA. And then we also have our database listed on 211nwo.org where you can also chat online with one of our CRAs. So thank you all so much for your time and attention today. We're really excited to continue our dedication in the food security space, but happy to respond to any questions in the chat, or folks are welcome to unmute with any comments or questions too.
Hi, this is Lisa Hatfield. I actually am the director of the Otsego Food Pantry in Wood County.
Hi, Lisa.
And glad to be here today. One of the frustrations I have, and I just thought that the presentation was awesome and the data collected, I will absolutely agree with it. I'm a behavioral health nurse who works with people and getting them connected with services. And so I see a lot of these struggles, but despite updates on our end, it seems like our information never gets correctly updated or stays correctly updated in the 211 database. How can we address that going forward? Not just for my agency, but for other agencies.
Absolutely. I don't know if either Sandra or Emily want to talk about the resource side or connecting.
Yeah, sure. So when you call in or email us or anything like that, what we do is fill out a resource correction form, and that goes to the resource team. So from that point, it does take a few days before it actually gets updated in the database, but they won't change anything unless they actually speak with you, or if they have if your website says those things, they can find it out that way, but they much prefer to speak to someone because we get a lot of information from the public and it isn't always perfect and correct from just callers, but definitely please email me or Jill and we can get your specifically updated.
Yeah, because I mean, even Kevin, in your presentation, you have our pantry listed at Hosanna Lutheran Church. It's never been there. And it's these inaccuracies that prevent individuals from getting the care that they need. So I'm just looking at that long term. And then is there we have the link to our United Way, but if say a group of nurses wanted nationwide access to 211, is there a nationwide link where they can just put in a zip code to get closer to an area?
That's an excellent question. So that's actually being developed from United Way Worldwide right now into something on national database platform. It's pacing to be launched in the next year, where you will actually be able to go in and search any 211 provider. The network, as with many different things, are fragmented in different spaces. So they really have made an effort throughout the course of the pandemic to align those. So that's something too that your local United Way will have access to, and we can push that out through our channels when that becomes available on a national level.
I'll also add to that you can go to 211.org and search any 211 in an area, and then you can also give us a call at 211, give us a zip code, or we can help to locate that for you, and we'll be able to tell you what the 211 in any area is as well.
And thank you, Sandra, for that. That's a great point. I just wanted to show this too on 211nwo.org. If you scroll all the way to the bottom where Emily was showcasing that search function, if you come down here and click service provider tools, it will also show you, you can come in here and get listed if your service is not listed, or if you have a login, you can log in. If you're not sure what your login is, to go and change your record in there, you can request a password and then go in there and do that digitally as well. So we're happy.
Yeah, and that's the frustration, is that those are things I've done in the past and it still reverts to inaccurate information, and I don't know why. Are people going to websites to gather information? What's the stopgap to help that from reverting to inaccuracy?
Yeah, absolutely. Well, I appreciate you bringing that to our attention. And we'll absolutely work with you and our resource team to make sure that record is up to date. Our process too is that on an annual basis, we are just pinging, our most recent agency contact to update that record there. So it's a, keeping thing as soon as
ongoing process.
Yeah, of course. We know contact lists are always out of date as soon as they're listed. But I again, really appreciate you bringing this to our attention. We'll make sure to reach out to you directly. But if other folks on the call are experiencing the same issue, please reach out to us and we'll connect you with our resource folks and make sure that that's accurate.
Yeah, I put my email in the chat if anybody wants to reach out.
Yep, I pulled it. Thanks.
Perfect. Yeah. Thank you.
And if other people have questions, I just have one more comment to share. I just don't want to monopolize.
No, go right ahead.
So when we had the COVID spike at the beginning of COVID, one of the things that helped our pantry is our partnership with our local school district and a couple local restaurants. The restaurants could get fresh fruits and vegetables when we could not get them at the store. So just building partnerships, handwritten thank you letters, things like that make a big, huge difference. And even partnering with the school when we could not get milk back in the initial COVID time, the school district got it and delivered it to us. So those are partnership avenues we definitely have to explore going forward, especially in our rural areas, because there are buses that go to every community that transport kids. And it's about utilizing the resources that we already have in rural communities to get things where they need to be. So we partnered together to make that happen.
That's such an excellent point, and that's so spot on with the partnerships. A lot of my background is in food security, and I've always felt that like the logistical challenges of food and sourcing and supply chain and distribution are the biggest hindrance. I am of the belief that we can solve food insecurity and hunger in our community. I think there's enough food, and I think that there are enough smart people around here to overcome these challenges. But to your point, it doesn't happen without partnership and having an understanding of what resources we have at our disposal, so then we can deploy them in the best way possible to make sure people get what they need. Thanks, Lisa.
In the chat, we have Margie Harris, First United Methodist Church Food Pantry in Bowling Green, Delivery service is the most common request from our pantry. We currently deliver to 50 to 60 households per month. We are at the max for the number of volunteers that we have. Any other ideas or suggestions?
Yeah, we've been thinking about volunteerism and how we can better support in that capacity. Margie, I'm going on the assumption that perhaps you could do more delivery if you had additional volunteer support. But please shoot us an email. Would love to discuss that. And Erin, our area director for Wood County, is also on the call. So perhaps we can talk about some resources that we could tap to explore what other supports that we could do through recruitment. You know, BGSU, I know, has launched a volunteer portal as well. So I think there's some options. We would love to explore that with you. Thanks, Amy, for putting in that DoorDash. I know that this has been what Kevin cited with Brown Bag having some delivery options. That's a really great partnership. Hoping to explore some other avenues there as well.
I was at an event yesterday at BGSU, and they do have a very comprehensive app. They just launched it a few months ago. But if you are curious, please reach out to me also and we can see. And we can also see if we have your agency listed in the 211 database as needing volunteers, as a place that people can volunteer. We have a lot of those also.
Thanks, Shannon, for putting the sign up portal in there as well. So we'll capture these links as well and make sure that those go out. Slides and recording will be sent out to all registrants after the presentation. All right.